So the birth of a baby is a beautiful thing. It is beautiful. It's amazing. God's creation. It's just awesome. But as beautiful as it can trigger a whole lot of emotion, and those emotions includes happiness, joy, peace in the Holy Ghost. Hello guys, welcome back to my channel. If you happen to be new, alright, and today is the very first time you're clicking on this video on this channel, my name is Ndi. I am a family nurse practitioner. I talk about everything health, okay? And today I want to talk about my new mamas. I want to talk to my new mamas. We are talking about postpartum depression. Let's cut off the stigma. Let's normalize this. Let's talk about it. It's very important. So let's get into this video. Let's go. I am so passionate about this topic because I felt like I had a little bitty touch to it, and as y'all know, for the people that watch my videos, you guys know that I am very passionate about blacks, very passionate about Africans, because we, as a culture thing, we don't talk about a lot of things, and this is one of those things that we don't really talk about it because there's this whole stigma and shame and attached to it, and nobody wants to accept, nobody wants to say that they deal with it, and then they don't get the help that they need. So guess what, we're going to take off the layers to that. Okay, so the birth of a baby is a beautiful thing. It is beautiful. It's amazing. God's creation. It's just awesome. But as beautiful as it can trigger a whole lot of emotion, and those emotions includes happiness, joy, peace in the Holy Ghost. I play too much. Anyway, those emotions include happiness, joy, and unfortunately, sadness, worry, anxiety, fear, especially for the new moms, okay? And that is not something that you can control. I don't think anyone actually sits down and say, I want to be depressed or I want to be worried about, but it does happen. So there's nothing you can do, absolutely nothing you can do about it. And sometimes it's not something that you expected, okay? You hear about it, sometimes you don't think it's not something you expected. So most new moms will experience what we call baby blues, okay? That usually happens after childbirth. It's very common. It's like mood swings, crying spells, anxiety, difficulty sleeping, and it typically resolves within like 2 to 3 days after childbirth. Sometimes it can last up to 2 weeks and then it's over. That's baby blues. Now, in some people, it might be a little bit more severe, and that's what we call postpartum depression. So I think I had a little bit of a baby blues when I had my last baby. The first two, I was so young, I don't even remember any emotions, honestly. But the last one, I can really remember being worried a little bit, especially at night. I will be so afraid, like, oh, is he breathing? Is he okay? Oh my God, he's so tiny. And honestly, I have no idea where these feelings were coming from. This is not my first baby. This wasn't my first baby. Like I said, this was my third one. So it's not something I would have expected with a third baby, knowing that I have had two previously. So I was like, oh my God, it's so tiny. I can't believe that God trusted me with this tiny little human being. Oh my goodness, I hope he's okay. I hope he's breathing. And I was so worried. And my husband was like, are you okay? Are you okay? I feel like he kind of was like, something's going on there, but he didn't like fully come out and name it. But for me, that lasted for, about a week or two, and that was gone. So that's baby blues. But postpartum depression is a little bit more severe than that. They are long lasting, and it also can happen in most women that have had history of depression in the past. Having a baby with a whole lot of hormonal imbalance and everything going on can trigger depression to reoccur, to relapse into this person's life, unfortunately, after having a baby. So it's very rare for it to, explode or expand into what we call psychosis. But sometimes it may also develop after. Psychosis can actually happen after childbirth. So postpartum, let's get this out of the way. Postpartum depression is not a character flaw, is not a weakness. It's not because you're a bad mother. It's not because you don't know what you're doing. But sometimes it's simply because it's a complication of after giving birth. It's simply a complication. It's simply like diabetes, like hypertension. Some people have hypertension after childbirth. And sometimes they do have it during childbirth. So just like that, just like having hypertension during childbirth or while pregnant, you can be depressed. So it's a common symptom. It's a common disease, just like every other disease. So it's not because you're weak. It's not because you're not a good mother. It is something that happens like every other disease, and there are ways to manage it to make sure that you're bonding with your baby as you're supposed to. So what are the common symptoms of postpartum depression? They include mood swings, crying, anxiety, sadness, just that feeling of, feeling overwhelmed, not being able to concentrate a lot, having appetite problems and not eating well, having trouble sleeping. I was lucky that when I had my last baby, my mother was here. So that was a huge help, because definitely having problems with sleeping and feeling a little bit of overwhelmed, feeling overwhelmed a little bit, that did happen. But like I said, mine just was just like for like a few weeks after I had the baby, like maybe a few days to a week, and then I was back to my normal self. Okay. All right, so that's like baby blues. Okay, now when it gets more severe, like being in a severe depressed mood, excessive crying uncontrollably, unconsolably, difficulty bonding with your baby. You see your baby is crying, but you don't have the urge to pick the baby up. You don't have that trigger of emotions that something is wrong with your baby and you should help your baby. Feeling overwhelmingly fatigued or at loss of what to do, loss of energy, fear that you're not a good mother, feeling hopelessness, feeling of worthlessness, restlessness, severe anxiety, thoughts of harming yourself, recurrent thoughts of death or suicide. Now we have gone into postpartum depression. Postpartum psychosis, the symptoms include confusion and disorientation. At this point, you don't know where you are. You don't know what's going on. Obsessive thoughts about your baby, especially like harming your baby. Hallucination and delusions, sleep disturbances, excessive energy, like you just have too much energy and you get agitated easily and frequently. Paranoia, hearing things, people thinking people are coming after you, attempts to harm yourself or your baby. Those are examples of psychosis. Okay, now let's put a little bit of twist into this that most people don't know. Postpartum depression can happen in new fathers. So if you did not know, now you know. New fathers can also experience this because, of course, it's a new change. It's a huge change. They may feel sad, fatigued, overwhelmed. They may experience anxiety, worry, the same symptoms that the mothers do. So please, if you see any dad, any man having these symptoms, don't say you're the man, you should be stronger than me, or all this blah blah blah. Please know that that person needs help and they need your support. It happens especially in fathers that are very young, and fathers that already have history of depression. They're experiencing relationship problems or struggling financially. Those are the risk factors for men for postpartum depression. They can have a negative impact on their partners, and just feeling that they are not good enough, or they are not helping enough, or they are worthless and stuff. So those are some of the things that you can see in a father, and please, if that happens, know that that person needs your help and they need your support. When do you see a doctor? If this doesn't go away in 2 weeks, okay, you're having these symptoms and it's been 2 weeks and you're still having it, and they are progressively getting worse, they're making it hard for you to care for your baby, please get help, because that baby have no idea what's going on. You yourself need help, because if you're not able to take care of yourself, you cannot take care of the baby. If it makes it hard for you to complete everyday tasks, if you're thinking of hurting yourself or hurting your baby, please know that you need help. Seek help from your primary care provider or other healthcare professional. If you are in the US, you can call the suicide hotline. The number is 800-273-TALK. Again, the number is 1-800-273-8255, and someone will be there to help you. They are available 24 hours a day. They can help you. If you are someone, you're a friend, a family member, please make sure that you're providing help, you're providing support to this person. There's not really any single cause for postpartum depression. It can happen to anyone. It could be due to physical or emotional issues. Of course, physical changes when someone someone has had a baby, there's a whole lot of changes in your body. Gain a lot of weight. It's like especially people that already had body issues, body image issue, it might trigger postpartum depression. Hormonal imbalance, with all that hormones going up and down during having a baby, especially a dramatic drop in your estrogen levels and progesterone in your body, can cause these symptoms to occur. Emotional issues, like when if you're sleep deprived or you're feeling overwhelmed, especially if you don't have help, which is why I talk to my new mothers. Make sure it's one of the important things that we talk about. Do you have help? Do you have anyone that can help you sleep when the baby sleeps? Baby may not sleep at night. That just means you're gonna have to sleep during the day, honey. If the baby's not sleeping at night, it's sleeping during the day, sleep during the day. When baby is sleeping, sleep. That might be your only chance to get good sleep, okay? Again, risk factors for this include having bipolar, having history of depression, if you had previous postpartum depression in the past, your baby has health problems or other health needs. It's people with babies that have Down syndrome, heart issues, genetic disorders that can trigger postpartum depression, because it's really hard to take care of a child with special needs. Having difficulty breastfeeding. I had a mother that busted out crying because they were not able to breastfeed your child, and I had to sit down and talk to her like, honey, you are a good mother. It is okay. It is not the end of the world. If you're not able to breastfeed, your baby will be just fine. My third baby, I wasn't able to breastfeed as I wanted to. I tried, I just wasn't producing enough milk, and guess what? At some point I had to give up. The other two, I had too much milk, and I was the one like, I ain't feeding these boys no more. They just gonna suck you dry, okay? So I quit. But this one, I was so determined. It's weird. It's funny how life works. I was like, I am going to breastfeed. I am going to do exclusive breastfeeding. I am pumped for it. I am going to. And it didn't happen. Did I kill myself? No, I did not. Because it's not going to change who you are. It's not going to take your Mother of the Year award from you. So you're fine. If this is left untreated, it can cause a lot of complications, which is why you have to talk to someone. For mothers, untreated depression, postpartum depression can last for months or longer. It can become chronic depressive disorder. It can lead to chronic depression. Okay, it increases your future episodes of having the same problem of having major depression. For fathers, it can cause a triple effect, like a ripple effect of other things. Okay, emotional strain for everyone in the house, because you're not okay with having a new mom, especially when the mother is depressed. For the father, it puts the strain on them. They have to care for the baby, and most likely most of the time will have to work too, and they're already at risk for depression, especially especially people that are already at risk for this depression, whether or not their partner is affected. It causes a whole lot of issues. For children, the children are the ones to suffer. They have to deal with all the emotional problems of the parents, and it can cause them not to eat well, sleep well, excessive crying, which further adds more stress to the parents. So please, get help. So how do you prevent this? Talk to your doctor. Talk to your doctor, especially when you start having these symptoms. Even during pregnancy, please, please, please talk to your doctor. After your baby is born, talk to your doctor about it. Treatments include, basically diagnosis is when you talk to your doctor. Collection of symptoms. They're going to do a depression screening. They'll give you a bunch of questions. You answer. Depending on what your answers are, they'll do some blood tests, making sure that other things are not causing this problem. Because if you're anemic, it can cause you to be fatigued. If you have hypothyroidism, it can cause you to be fatigued, weight gain. It mimics symptoms of depression. So those things will be ruled out to make sure that that's not what's happening. And when everything is ruled out, most likely you're going to get engaged with a therapist. So you're going to get set up to talk to a therapist. Get as much help as you can. Get rest. Connect with other new moms. It's amazing. There are apps for that. Just make sure that they're right. Okay, just saying, avoid alcohol and other recreational drugs. Again, therapy, and if you need to, you can get on antidepressant medication to help you, and it is okay. It doesn't take anything from you because you are on medication for depression. Please take care of yourself first. When you get things under control, then you can talk to your doctor about weaning off of the medication. If you're a Christian, as I always say, talking to your God about it, talking to your other Christian members, if you have a church group, if you belong to a church, talking to your pastor, your other church members that you can trust, because it's not everyone that you're going to share your problems with. Talking to someone that you know will offer help in praying with you, because for me, I always say, God heals everything. So if you have the faith, if your faith is strong enough, then God can heal you. But until your faith is there, get help, okay? All right, my mamas and papas and uncles and aunties, because we all know someone that just had a baby, or someone that is going through this, or maybe you have seen these symptoms or signs, but you just didn't know what they were. But now that you do, I trust and believe that you're going to get help, or you're going to talk to this person, or talk to someone that can help them to get help. Okay, be your neighbor's helper. Okay, be your neighbor's keeper. Be a good Samaritan. Until next time, I love you so much. Thank you so much for watching my videos. Share this video with someone that you know that will help. Don't forget to subscribe. Put your comments down below. Let me know what's up. Let me know if you like it, or if you want anything else that you want me, if there's anything else you want me to talk about, please do, and I will. Thank you so much. Until my next video, ciao.